Well, it's my pleasure to be here. How many of you were not at yesterday's workshop? Okay, I'd say about half the folks, okay. Well, I had to go and just rewrite my whole talk as a result of the workshop, so it was that good. For those of you who are new how many of you are already kind of low carb and keto, old hat, Anybody kind of new to this? Like, you're kind of here curious, you're dragged here by your friends and Doug, can you remove her, please? That's a demonstration that this is not a cult. We're not going to have you removed. Okay. Don't, Doug, don't remove her. No. So I was given the task, or asked for, to talk about type 1 diabetes as part of a workshop and as a devoted day to it. So I thought, in the hope of maybe doing things that have worked in other areas and then avoiding the things that didn't work in other areas and applying what we've learned for low carb and keto in general now to advancing what we know about type 1 diabetes. So I kind of have a metaphor here of this is the grassroots organization of bottom-up change. If you're not aware of that, that's where a lot of things happen. A lot of paradigms, a lot of entrenched forces at the top won't change, and yet we need to still live and be healthy and happy, and we can do that without the top being involved even. That's kind of crazy coming from a doctor, right? But just to let you know about my background, I am an associate professor of medicine at Duke University in Durham, North Carolina. I direct myself and a nurse in the keto medicine clinic. It's this huge, vast operation with 2 rooms. I'm getting used to a little, irony and sarcasm, and yet I've published over 50 peer-reviewed papers on low carb and keto, and the terminology has changed through the years. You might have heard of LCHF. So you go watch Serial Killers, 2 epic movies about heroic athletic activity done without eating carbs, and they use the term LCHF. It's okay. It's really kind of the same thing that we're talking about today. And so the term keto really came about based, on all these other forces like companies making products and junk keto foods, things like that. So I've seen it change from Atkins induction to keto today. I got roped into the leadership of the Obesity Medicine Association, which is the largest group of physicians who treat obesity in the world. And they used to be, they still are medication focused, pretty much. So the SMHP is a place where you don't have to be a physician. And I think the real way to solve our epidemic is to train people to do this, kind of like relief workers. You don't need to be a physician and know how to do surgery to go in and tell someone not to eat carbs. So a lot of, how many of you are coaches and have gone through programs? I mean, I think this is really, you're going to be the ones to really make the change. Well, maybe not. At the end of the talk, you tell me. I'm co-founder of Adapt Your Life and Adapt Your Life Academy. I'm going to talk a little bit about the company, but also talk about other chances similarly. I'm an author and do hardly get any book royalties. Don't quit your day job and write books. It just doesn't, unless it's massively popular, it's not a great way to make money, but it's still one of the disclosures I want to make. So the grassroots movements for obesity and type 2 diabetes, for keto, low carb, LCHF, Atkins induction. Does anyone remember Protein Power? I mean, it didn't even say keto, and it was a keto approach. So all of these things have been around a while, and when I got into this, and every doctor comes to this like they're the only ones that ever have thought about this, okay? So just be ready for that. I thought I was the only one that ever thought about this back in 1998, when 2 of my patients lost over 50 pounds on their own without me. I thought, what gall is this? But it was the VA. They were all Vietnam vets at the time, pretty much. And so I asked this man, and I said, "What'd you do? You lost all this weight?" He said, "All I did is eat steak and eggs." And I'm sure I jumped out of the chair. Now someone comes in, I'm eating steak and eggs. I go, "Oh boy, you're doing carnivore-ish. Depends which version, right? Okay, some of you know about that. So these patients were doing great. I went to the bookstore, and there was a Ornish book, the low-fat thing, and I called, and I said, "Can I go visit your clinic?" Well, they didn't have a clinic. So my first, not all doctors with books and websites and YouTube channels and they don't all have clinics. It was Dr. Atkins who had a clinic, 1998. So I went to visit. And yes, you can laugh. I had hair, it wasn't gray. And that's me on the far right in a old Polaroid camera that was used to take a picture in the basement of the Atkins Center. At the end of Dr. Atkins' career as a grassroots practitioner, he had a 4-story Midtown Manhattan clinic and was seeing patients all over and selling products and nutritional supplements. And the doctors where I worked at Duke said, he's in it for the money. He's just a quack, I said, well, maybe I should go take a look. It was Dr. Atkins who actually said, "Why don't you come visit the office?" And that's what I do today. It gets higher every year. So 25 years later, I say, "Why don't you come to my office and take a look?" There's so many barriers that you're just not going to understand. Well, what about, you have to have breakfast. Oh God, just come to the clinic and let's talk and see it in action. So I went up and not only said, you need to do research, I had, of course, in the back of my pocket a research proposal and said, you need to fund it. Fund this research. We go back to Duke and the VA, and they funded it. That review from when that paper was being published and submitted, one reviewer came back and said, we're just not used to having papers funded by doctors. Because Dr. Atkins wrote the check, and I was transparent. I said, well, the funding came from Dr. Atkins. So, but it worked. So I didn't just go and then come back and use it. Like any good researcher, I studied it myself. So what you want to do is get researchers not to believe what you know and think is true. You want to get them to do the research. So if you can fund them, but don't fund the people who will probably lie, cheat, and steal and ignore the results. That was, I'm afraid, one of Nusi's issues, if you know that backstory, the nutrition initiative. But so I get into this kind of not really knowing. Two of my patients did this. So the first thing any good scientist does is looks to the literature. There were no studies. No, so the most recent one was 1980. Remember, this is 1998, so about 20 years later. And it was 24 people who were rounded up at the NIH intramural program, put on the diet, and they all lost weight, but their LDL went up. The LDL went up. And so it was the nail in the coffin in an era where saturated fat, when you knew it was going to kill you, just looking at butter kills you. Didn't you know that? And now you have people putting butter on steaks. Have you ever seen Butter Bob Briggs and his teaching? I mean, it's kind of, that's just, you can have butter. But so we started doing some research and finding things that were counter to everything we've been taught. Thankfully, I'd been schlepped around as a child with my parents, and I had been to a country where they drove on the wrong side of the road. Oh. They drove on the left-hand side of the road. Can you imagine? It felt so wrong. It felt, and sometimes unsuspecting Americans get hit by cars because they don't look the right way, the correct way. So anyway, there had been a taboo on studying this, and everyone knew it was bad, and it's even ingrained as a different word, sorry. It's even inculcated as emotion now. Because you get into the car on the wrong side, and you can't go around the the roads on the wrong side, so it becomes emotionally invested. It's a paradigm. It's how, it's just what you live with, but there may be another way. So the grassroots of using low-carb keto for obesity and type 2 diabetes reversal was carried on by some doctors who wrote books. The research, now I'm doing this more to show you the year here on the left rather than the results, because low-carb won every time. But if you pitted low-carb and low-fat side to side for obesity treatment in the early 2000s, pretty much you have to wait till a meta-analysis, which is a summary of all the studies that are done. But now you want to make sure that it's a meta-analysis of randomized controlled trials. I've seen those observational study people say they have meta-analyses of observational study. No. You want observational, you want randomized controlled trials, not just nutritional epidemiology. That's association is not causation. Thank you. Preaching to the choir. So anyway, the years passed, 10 years now since our first study, and Will Yancey at the VA in Durham, one of my trainees, and now he's got his own shop in obesity treatment. He said, well, this is so powerful, the low-carb diet. Let's do a study where it's within the VA, people who aren't otherwise healthy. They have disease and other problems. And let's do the prevailing study of what was used at the time, low-fat diets with a fat blocker called orlistat. And they worked about the same. So a diet was as good as a diet and a drug. It's not that a low-fat diet and orlistat can't work. Of course, there are fewer side effects on the low-carb diets. In general, you have fewer bowel movements on a low-carb diet, and on a low-fat diet with orlistat, you have more bowel movements. I was sharing an office where they were doing research with orlistat. It's a fat blocker, so any fat you eat comes out the other end. And they had 10 different ways to describe the bowel movements. Was it oily stool? Was it floating on? Anyway, I didn't do a study on orlistat, but I didn't want to. So now, what happens? Time passes, and these patient advocacy organizations, or you want to call them parental organizations, people who are affected by these things. It's not the top down. It's the Public Health Collaboration at the UK. Hooray! Shout out to them. Started to put the evidence out online and infographics like this one to just show that the low-carb diet basically head-to-head beat out low-fat diets. And if you put it all together, this is enough evidence to be an FDA-approved drug, but it's a diet. So there's no process for approving a diet. Any Tom, Dick, or Dr. whomever can write a book. There's no process. Maybe there should be. But anyway, there's a lot of research in terms for the obesity and type 2 diabetes. That's one thing, but now how do you get into organizations? I didn't really know. I'm in academia, I've been on some VA guidelines, and I heard someone just become the loudest person in the room, and it got into the guideline, even though there was no evidence. Like, is this real? Am I living this life? And so I get on the leadership of the Obesity Medicine Association, and I learned we got to put the low-carb diet in the guidelines. So while I'm president of the organization, by gum, we actually had the evidence, put it into an evidence-based guideline as leader of the organization. Is that cheating? No, that's how it works. I thought I'm so spoiled as a doctor, I thought someone else was going to do this for me. By gosh, by now someone else will put this in there. Now switching to diabetes. So not only the OMA, but Obesity Medicine Association, but the SMHP has a guideline for obesity. I'll get to that about diabetes in a minute too. Here, there's all sorts of irony and twists and turns, and I have this old copy in my office, 2 pages from this book, and that's why it's so tattered, and it was a used bookstore owner, a patient of mine, who brought it in and said, Dr. Westman, I heard you were a history major here. So while I was doing my first study, the director wanted to clamp down on it because a dietitian complained I was doing a study on high-fat diets. I couldn't say that without a stutter back then, high-fat diets, but I couldn't then. This book lands on through a patient, lands on my desk, and I go, I wonder, Sir William Osler is the father of internal medicine. What did they do in 1923 in terms of diet? Open it up, 10 grams of carbohydrate a day. I was giving people 20. I'm glad you can laugh at that. In a dietitian audience, they gasp at how low that is. And I still want to go around the roundabout the wrong way. I don't know why that is. You go to another country and it just seems wrong. That's the same list of foods I give out today. So there aren't as many studies, and just for the sake of time, I want to just say there are a few studies about diabetes, and pretty much less carb in the food, the blood sugar goes up less, you get better glycemic control. I mean, this is like not rocket science. It used to be called sugar diabetes. I wish that's what it would be called again, because it's elevated blood glucose. I will quiz people, the residents, the students, even visiting doctors. I'll ask, what is diabetes? And it's amazing. The first thing that comes out of people, well, it's not enough insulin. And I said, no, it has nothing to do with insulin. They're not measuring your insulin when they call you someone with diabetes, affected by diabetes. No, they don't. They measure blood glucose, blood sugar. Yes. So, it's food with sugar and starch. It makes so much sense. Nobody thinks about it. Dr. Yancey did those studies with people in the VA and with diabetes. He got on the committee for the American Diabetic Association and called me one day during one of his programs where they were coming up with the guideline in this paper here. And he said, Eric, they want to remove the research on low-carb diets that we've done. Now, I was thinking back to that Dr. Westman, as president of the Obesity Medicine Association, made sure his research was in the guideline. I said, well, you can't let them take it out. So they wanted to censor the science from a guideline. That's it. He stuck to his guns. It's still in there. The guideline says use low-carb diets. But you don't see it on their website. You don't see any change in the public-facing materials. So at SMHP, thanks to all the people who put work on this, including Adele Height, the guideline on therapeutic carb restriction, we now call it carb reduction, just to be a little smoother, in the website materials. You don't want to restrict anyone, and as we learned yesterday, you don't restrict anything if you're eating lots of bacon and steak, and you can make all sorts of great foods, even for children who can't tolerate carbs. And now there are two textbooks. The really geeky one on the left, Susan Messino in Boston did the heavy lifting there. Ketogenic, which came out this summer, was published, and the heavy lifting by Prof. Noakes, Tim Noakes, and his team at Nutrition Network. Thank you so much for doing that. Will Yancey and I contributed chapters on diabetes and obesity treatment to that textbook. Switching gears, grassroots ketogenic diet for childhood epilepsy, still confusion today, and even I went to Wikipedia, the fount of all knowledge, and the confusion was there. It says a ketogenic diet started with epilepsy treatment. No, there was a keto diet in diabetes and obesity treatment. They're different. So in the 1920s, Dr. Wilder at the Mayo Clinic started treating people with treating epilepsy patients with low-carb diets, and it worked. And you can even go back to the Bible where they fasted people and their fits went away. I mean, if you loosely interpret that as seizures. The Charlie Foundation was created by Jim and Nancy Abrams, and by chance, Charlie was the son of a Hollywood producer. Lucky guy, had all the resources in the world. So Jim Abrams and his wife find the ketogenic diet at Hopkins. There was this one nurse, or wasn't a physician, who just kind of kept the flickering candle going at Hopkins. And she found they found her. Meryl Streep was a friend, did a movie, 1997. Even to this day, Eric Kossoff, though he's writing papers and created an international organization of people who know about the keto diet for epilepsy. He's even done a modified Atkins diet, which is more like what I teach. You don't have to be so strict about macros and all that mess. You don't have to measure ketones. That even works. So he was, 100 years later, he was finally saying, do we have to follow what was created in the 1920s? Maybe we can modify it a bit. Even today, he admits most neurologists use medications. And the lucky child today has someone when they're, in their 10-ish, someone says, well, hey, you have seizures, why don't you try that keto diet? Or, so even after all this time in the keto for epilepsy world, there's not a whole lot of organizational approval and support because they mostly use medications. Now, McArdle disease started at this clinic. I heard that, or at this meeting, what happens here changes the world, and in this case it did. The 4 people who got up and talked about their McArdle disease at one of these meetings and said, we're better, we don't know why. Stacy, this real energetic non-physician, wrote up the case series, got together the international researchers on McArdle. It's small enough so that pretty much all 6 world researchers were in one room in London. So one strategy is to get the researchers together, fund them to get together, thank you for funding this meeting. It's sad that we have to do GoFundMes and ask, for the pennies with our hats, but we're not up there with all the money yet. So she puts on a meeting in London that basically says all of these people say they're better. She creates a Facebook group or internet support group, starts to survey people, and the latest is that, and this is what researchers will do. They say, oh, well, that keto diet helps McArdle. I wonder, what if we gave ketones and not change the diet? Because, it's so hard to change the diet. So the simple thing was, well, let's just give ketones. Well, it didn't work. So I was in that room in London with the researchers of McArdle who were experts in McArdle, but they didn't really know about diets or randomized trials. But anyway, this group had already planned these studies. The second one, can a modified ketogenic diet? So these papers came as a result of that meeting from the person with McArdle who found other people with McArdle at this meeting having similar results. Here they make the fatal flaw, or limitation, should I say, that they say, well, it really didn't help much. Well, let's look at the detail there in the abstract, and I'll just pick it out. Let's see, it was over a 3-week period. So would you expect someone over a 3-week period to have massive improvement in keto adaptation? And how long does it take? It could be 3 weeks, 4 weeks. If you wanted to go in a rowboat and row from San Francisco to Hawaii, it took 6 months for Sami Inkinen and his wife in the movie Serial Killers. So if muscles need that adaptation time, basically, this is what happened in the obesity world in the 1970s. They said, well, we did that Atkins diet for a week. They lost this weight, and then they regained it all. You see, it doesn't work. Well, and then I went to a doctor's office, and people who had been on it for a year, and they lost 100 pounds. How could that be? So the first flaw or idea of a researcher is, well, let's use ketones without the diet. That may or may not work. And then let's just do it a little bit, because if a little bit isn't good, then then a lot of it won't be. No, you have to get over that keto adaptation period. So they do have a recent publication and it's a survey of people who have done McArdle, and 90% of them say they're better if they do a keto diet. Now, this is an orphan disease that they had to borrow the room of the funded muscular dystrophy researcher in London. Turns out Stacy was good enough to, or the researcher was talked into doing a meeting on a disease that she didn't study. So with something like type 1 diabetes, with so many more people affected, it seems like something like this could happen. And so Switching to type 1 diabetes, again, yesterday was just phenomenal, and today is going to be amazing too. The grassroots changes. But before I get to that, I've often, like the patient who brought me the Osler textbook of medicine, yeah, I was a history major in college. Not that I had to, wrote an honors thesis, but I didn't have to do a grad level history. I was pre-med all the way. But I do learn from history, and Gary Taubes wrote this book, just came out this week. Last week I pre-ordered mine. It's called Rethinking Diabetes. And in classic Gary Taubes style, it's dense. How many of you read Good Calories, Bad Calories? Yeah, well, you didn't? No, just kidding. That tells the story of how the low-fat diet was never based in science. So the fad that we lived through is the low-fat diet. Even though people out there say the low-carb diet's the fad, the low-carb diet's the one that's never gone away. So the history, Belinda Leonard, first author on this paper. Thank you for putting this together. So it's all the history, and I have to say I added, forgive me for adding this to the figure, just to categorize it, to simplify what is, it's a riveting story to someone who is a history major and a doctor and sees people do great without carbs. I just need that reassurance that 100 years ago, all the doctors prescribed a low-carb diet. And what changed was this thinking. So the biology didn't change. It would be like you still see the sun coming up over there, and it still goes around the earth and goes down over there. That hasn't changed. But you were shown little models as children about the universe, and I hope you were, the solar system, and it even explains the moon phases. Remember when you knew that once? At least you were exposed to it. But it still looks like it goes around the earth. I know this seems crazy. But carbs in the food still raise the blood sugar, despite the fear of fat, despite the push by doctors to put you on medicines or whatever the forces are. And it boils down, best I can tell, and Gary didn't take my advice and change and put like a big line in the book right here, because the whole first half of the history of the treatment of diabetes, doctors didn't know if they were type 1 or type 2. The whole worry about fat in the food came way before there was any differentiation between type 2 and type 1, and even before the low-fat movement in the 1980s. And so the seed was planted even among straight endocrinologists, diabetologists, that fat in the food was causing the diabetes. And it did not make sense to me, but it made sense to them. They passed along that information. So one of my teachers at Duke, he's just beside himself that I would tell someone to eat saturated fat. He's a professor, gentlemanly, one of my, people I look up to as a doctor. And I just say, you're driving on the wrong side of the road. Oh, wait. I point to those Australians and the UK folks. So it's independent of how you believe, how you care about people. You have a belief system. And the sun has always gone around the earth, even though you know that's not true. But food has always raised the blood sugar. You can use a CGM now. But now it's to the point where, doc, I want a CGM. Why? You know it's going to go up when you eat carbs. Well, I just want to see it in myself. Anyway, because maybe there's such a disbelief in what doctors have said. I get it. So insulin resistance was coined as a term to describe what happens with hyperinsulinemia. So at this time, it was in the 1960s when the radioimmunoassay was discovered that they could measure these minute, it's one in a billion particles to measure insulin. It's really hard to measure. Imagine you're the doctor, this person has diabetes and their insulin's already high. How do you wrap your head around that? we'll call it insulin resistance. There's something in the cell that's causing it not to work. It's got to be something in that cell, and they've been searching for that, ignoring the fact that diet fixed it, reversed it before there was any differentiation between type 1 and type 2. You can measure insulin. And one of the brilliant things I've learned from this book, which again is fantastic, I always feel like I'm a real scientist when I read Gary's books, because he gets quotes from, change happens funeral by funeral, all those sorts of things about why don't people just see it? It's because, well, it's a paradigm. It's the way you've grown up seeing something. If insulin had been available to measure and you were starting out without any preconceived bias, endocrinology would measure a hormone, and if the hormone's low, you would give it to put it into the normal range. If the hormone is high, you would lower it, not give more of it. I mean, this is classic endocrinology. And the diabetes scientists flubbed it. Well, oh no, wait a minute. I'm on the chapter where you only know what you can measure. Basically, I mean, you can only see what's there. So all that you know is what you can see. They couldn't measure the insulin. So let's give a free pass to those people. But the people right now, endocrinologists, diabetologists who are measuring people and their insulin levels are high, you don't want to give more insulin. Does that make sense? It doesn't work. I had someone who gets the best medical care in Duke in my, upstairs in my clinic space, where I have those 2 clinics, rooms, and an office. She was on the equivalent of 600 units of insulin, because now when it's U100 and you can't have enough room to inject it, no problem. We have the double dose, the double strength. She was on the triple strength, and was on. She took herself off of her own insulin with guidance in 8 weeks. So, well, no, it's reliable, it's replicable. Sorry that I heard this morning that someone's loved one is getting an appendix removed, appendicitis overnight. You don't clap for appendicitis removal. It's common. It's expected. Why? I wait for the day when you come in and you go, of course, it came off the insulin, because that's what you expect when someone does a low-carb diet. Reminds me of the patient who came in and said, you're pretty sure, you're pretty cocky about this. And I said, yeah, I do it every day. Reminds me of when I met Dr. Atkins. But I have the science behind me and the clinic. So you got to learn from histories who don't repeat, and hopefully we can go beyond the history, but why not use diet with type 1 diabetes, which is insulin deficiency. You measure the insulin is not high. That's type 2. We know that there's something different. So these folks need insulin, but how much do they need? Well, you base your insulin based on the carbs you eat. So the fewer carbs you eat, the less insulin you need. And the less insulin and carbs you go into the system, and there's only 5 grams in the entire bloodstream. I wish that would get into the teaching for type 1s. There's only 5 grams of sugar in the bloodstream. You eat an apple, it has 20 grams of carbs. It's no wonder it raises the blood sugar, and you need to adjust your insulin as a result. So kind of like, Dr. Atkins had obesity. He treated himself, wrote a book. Dr. Bernstein has a type 1 himself, wrote a book. Keith Runyon, I don't hear him being talked about much, has spoken at these meetings at the Metabolic Health Summit before, has a book on mastering type 1 diabetes. But now there are also publications on type 1 diabetes. Now this is contrasting when I started in the obesity diabetes world 20 years ago. We didn't have this stuff. I mean, we had the books, but we didn't have these curated reference resources. So I just thought, let me go to the Nutrition Network, see what they say about therapeutic carb reduction and metabolic syndrome and type 1 diabetes. Oh my gosh. Studies on up through 2023, this is a current, and there's 3 databases online now that you can go to, and there are all of these studies. In fact, we're going to hear from Dr. Turton today. So there are these proof of concept studies, you would say. And then there's all of these case reports and children and adolescents. Oh, there's Dr. Leonard's again. So anyway, there are now resources where you can go and get the science that's already done. This wasn't available to us 20 years ago. That's fantastic. And then the media links, and it's not complete. I mean, you might know Dr. Diolis, Kutnick, and Remington. I didn't know Dr. Olivia Remington. But there's also Dr. Troy Stapleton, who's got a lot of YouTube presence, type 1 himself. And so all of this information is there. We didn't have the internet resources 20 years ago. We wrote a paper just to show how easy it would be to do a randomized trial. The changes in A1C are so big. And we saw this with our low glycemic, low carb diets, that with just 50 people, we had statistical significance at 6 months between these 2 groups. It doesn't have to be a big study, but it takes a lot of money to do research these days. And I was looking this over again thanks to the River Foundation and Beth McKenzie, who had some talks yesterday. You're cited down here with Dave Dykman giving thanks to you. The proof of concept study basically means you have, well, N means the sample size of 12 people. This really probably doesn't count. Second one, we'll hopefully hear an update, 16 people in a single-arm clinical trial. Well, this is a pretty good one. It seemed like the methodology there could be replicated again, and it was a pilot study going towards something new or something else. But meanwhile, while the studies are being done, the Facebook group surveys, I think, are an effective way to effect change. And Type 1 Grit was set up with Allison and other folks here in the room. Type 1 Grit is where I send all my patients with type 1 diabetes. They surveyed their folks, and actually was done twice with laboratory validation of the self-reported A1C drop, so it wasn't just taking people's word for it. So doctors, have you noticed, sometimes I wonder if endocrinologists are particularly bad. They don't really believe you. Doctors, especially in the weight loss world, the doctor will say, just go home, eat a low-fat diet, and they come back, I did it, I gained weight. Well, you just didn't do it well enough, right? Doctors are kind of skeptical, and so we anticipated that if we published a study showing self-reported A1C reduction, the doctors wouldn't believe it. Of course, why would someone lie about that? So the Harvard group ponied up some money to validate the A1Cs, called the doctors directly, and that's why the tables are kind of a bit large, because they have the self-report and then the validated A1C, and of course it was very similar. So you can get almost normal blood glucoses even with type 1 diabetes by lowering your carbs. That's the Type 1 Grit Facebook group method based on Dr. Richard Bernstein. The critiques I've heard of this is that, that's just my patients wouldn't do that. So it's self-selected, it's people, superhumans can only do it, and so you have to be sensitive to that. But the rebuttal in the journal was really egregious, because the doctor just said, drugs are the way to do it, and this is just a Facebook group. Come on, that's trying to stamp out the grassroots that won't be stamped out. There's a patient advocacy organization called Let Me Be 83, which is based on Dr. Bernstein's idea that the perfect blood glucose all day long is 83. I didn't have the heart to tell him that it was based on a study of people who eat carbs. That's kind of an inside joke. But I don't know that you have to be 83, just saying. But it's a great resource until there's a cure, there's a solution. You go to the website, there's information that you can get. There's a wonderful documentary film called The Diabetes Solution. I watched it this morning. It's an hour long. Just word of warning, I learned, or not. I learned from Dr. Atkins that if you bashed other doctors, it didn't help you among other doctors. And you read the old Atkins books, the nutrition was fantastic. The doctor bashing was a little off-putting to me. Again, if you want to change organizations, don't tell them that they're messing up. But doctors work hard. And if you go in and say what you do doesn't work, you're not going to make friends, unless you solve it, give them a tool to do it. So people work hard. They're pulling people out of the river, and at the end of the day, they feel like doctors, even though they're not doing the right thing, the best thing, the thing that can actually reverse diabetes. So my one critique, and remember, I'm a critic, I'm a reviewer, no doctor bashing, please. If you want to change the organizations. So in this film, it has a little like, all doctors and the companies and the government collusion, but that might be persuasive at the grassroots level. I don't know. But I would love to see this watched by, say, a focus group of 10 endocrinologists to get their feedback. Because you're telling them that they're doing the wrong thing. Dave Dykman, son of R.D. Dykman, wrote a course for Adapt Your Life Academy. I'm founder of that academy. I thought, how can I help get this information out? This is a deep dive. I asked a rocket scientist and a psychology wife and 2 super smart children to put a course together. In 6 months, it was done. We sent we took the video, we put the course together, and it opens up and closes periodically at the website. We don't really do evergreen teaching there, but I'd love to have this be more widely used within the type 1 community if you think it's appropriate. But kind of like Dr. Bernstein's method, it's tough. Dr. Bernstein's tough. R.D. Dykman's tough. He's even watching his blood glucose of his son while he's a college student over that thing called the internet. So it kind of changes the description of helicopter parents even. And yeah, just like yesterday, the stories of, well, my teenagers, they're going to experiment. Yeah, of course they will. Although my kids in their 30s now, I say, I really don't want to know what you did back then. You don't have to tell me how much you drank and all that. Okay, some of you don't have kids, or maybe you're okay. Sorry. Anyway, so this course, much like we saw yesterday, much like we'll see, I hope today, this is terrible disease to have to not only affect you, but affect your child. So I didn't get the feeling of like I did with Lorenzo's Oil movie with the Diabetes Solution, although it made me bawl as well. But so R.D. goes through Dave's story and tells you how to manage the blood sugars, how to manage the insulin, and here's Dave now, an athlete, and so are so many other parents of type 1s. Their kids are just thriving if they're not eating carbs. But what's also cool is the family came back with modules done by the mom, who turns out to be a psychologist trained in. So these were the questions I heard yesterday on the stage. My child is a picky eater. What do we do? Well, she deals with it in this course. How do you deal with teen rebellion? So it's a very down-to-earth, created by a family with, of course, very energetic and devoted family, which again, I think is going to be one of the things that needs to be in the transition to teaching more and more people. My first time I watched the program, there are videos in there, and I went through the course before we made it available. A lot of people are going to look at this and say, I'm not going to do that. I can't do that. That's too much. Wake up my kid every night, check the blood sugar, and then give him insulin. Now, some people will do that, but anyway, so I think there need to be different levels of control and difficulty. And the diet can be very simple. I've learned from the obesity, diabetes treatment world. And then even Dave's on there now doing question and Q&A. So if you have a child with type 1, you see the child with type 1 here talking about it. If you're the mom, you're the dad of the type 1, you're talking to, albeit very educated and motivated parents who've solved the problem based on Dick Bernstein's method. And so that's our type 1 diabetes offering at Adapt Your Life Academy. Wrapping up. So the grassroots for type 1 starts with you doing it, the people. And I was so thrilled to hear about the Let Me Be 83 group, and there are resources available. There is the documentary film, getting the word out. Again, kind of like Doug was saying, you tell one person, another person tells another person. This can grow, the grass can grow from down here. You can expect. Worry about the LDL cholesterol. I went through it 20 years ago. One of the first things I did when I met Dr. Bernstein is I said, well let's do a chart review. So I got 20 of the charts and the massive changes in the A1C, and if you had resources and time, go visit Dr. Bernstein as a patient or as a parent of phenomenal. And he's in his late 80s. Anyway, he lives outside of New York City, Mamaroneck. It's just a flight into LaGuardia, ride out to Mamaroneck. Don't worry about the LDL. And there's now a lot of evidence that it's really something called metabolic syndrome, the triglyceride and HDL in the blood. And sometimes they're at odds. Sometimes the LDL can go up a lot, but the triglyceride HDL pretty much always looks good. And there's a study that just was, preliminary results were released in December by Dr. Budhoff, B-U-D-O-F-F. It's the lean mass hyperresponder study baseline results. Phenomenal video to watch, you can watch our reviews of it on our YouTube channels. Just about all the keto folks have done a review of that. The study is not done by any means, but it's an early look at what can happen when these people have really high LDLs. Now, if you haven't started a low-carb diet, or if you're halfway through your journey, most people's cholesterol levels actually all look good across the board. Remember those two patients I met at the VA, first thing I did is I checked their cholesterol level. And it was a stroke of fate and chance, because actually, if one of them had been a lean mass hyperresponder, that kind of result, I wouldn't have studied this. But statistics and chance and dice, and 2/3 of the time, it gets better. And so rolling the dice twice, very likely you might get 2/3 having a good response in or what we think is a good response in the cholesterol. Don't worry about the LDL. Expect confusion about what keto is. Even low carb, high fat, even LCHF, even Atkins, even all this. I joke, just tell them you're doing the Mediterranean diet. Gauge the emotional response, and then the subsequent follow-up. Oh, well, that's good. And they go on with their life. They don't say, well, are you giving them the Mediterranean oils? And no, it's just the word of the day that kind of says, well, that's okay. But teach a simple version of the diet, and I can see this being a problem as you roll out type 1 teaching from, almost like Dr. Bernstein is like Moses taking the tablets down from God, and now we have churches and pastors and priests and rabbis who kind of say, well, not everyone can be perfect, progress, not perfection, and so keep it simple. I'm wrapping up on this slide. The standard treatment of diabetes, type 1 and 2, was a very low-carb diet until the middle of the 20th century, and doctors didn't know the difference. So a lot of the routines were entrenched before it was known that there was such a thing as high insulin level in the blood. And the treatment focus was taken away from nutrition and placed on measurement of the blood and giving insulin and all that. The proof of concept studies for the grassroots of type 1 diabetes are there. And just a word of a caution, keep the intervention as simple as you can. But because the effect is so strong, these randomized trials don't have to be large. They don't have to be expensive to do. At the same time, so I still think it's important to do research. If you're going to want to change the view from the top and guidelines, and even to get more doctors involved to help more people, you don't have to wait for that. We can also work toward organizational standard practice endorsements and guidelines. But as history researchers may have to get on guideline panels, and often that's not comfortable. A lot of researchers don't like confrontation, and guideline panels can often be confrontational. Expect non-endorsement or even antagonism from organizations focused on medication only, but don't be distracted by them. Think about it. If an organization is based on a low-fat diet, the Church of Low Fat, it will always endorse low-fat diets, not low-carb diets. The Baptist Church isn't going to change to Catholic Church, right? If an organization was based on medication treatment of cholesterol, the National Lipid Association, for example, and all of the doctors who are trained through that organization, one of my teachers was one of the people who started that organization. It will probably never endorse dietary treatment. It's based on medication treatment. Finally, don't be discouraged. Like Dr. Atkins and Jackie Eberstein, who I need to just thank again, who worked with Dr. Atkins for 30 years, has helped me over the last couple decades. And she said, we got up every day and went to work and everyone was getting better. We had no idea, we had no awareness and didn't feel like they were in a fishbowl hurting people, because they weren't. So feel good that you're helping people along the way, even while other people are not quite sure of it. And that's really what keeps me going every day at Duke. And yet people come in worried about all of this and worried about that. And I still look in the sun. Dang it, it goes around the earth. Look, just look. Okay, that's kind of sarcasm and irony. You're supposed to laugh a little bit. The earth goes around the sun, but it sure looks like it doesn't, right? Thank you. And I hope the grass will grow and end up to be this wonderful, beautiful lawn. Credit to the sod father who's here. Thank you so much.